If you have a heart condition, you're not alone. Figures published for 2008 showed that around 2.7 million people in the United Kingdom had coronary heart disease. The number of people dying prematurely from heart disease has fallen dramatically, but because we've got better at identifying those at risk and diagnosing heart attacks early, the number of those living with it is growing. Of course, help is at hand. Whilst we cannot yet cure heart disease, we can treat it. Thanks in part to research funded by the British Heart Foundation, most people who have coronary heart disease no longer need bypass surgery. Their symptoms can often be controlled with medication or treated with procedures like angioplasty. For some, however, such as those with heart valve disease, surgery is still necessary, although techniques are improving all the time to reduce the need for conventional surgery. Whether you have had surgery or an angioplasty, or need to have better control over your angina symptoms, there are plenty of changes that you can make to help you live as normal a life as possible. For example, being physically active is one of the most important things you can do to aid your recovery, and people who are physically active are less likely to have a heart attack than those who are inactive. Being physically active will help you stay at a healthy weight and body shape, and will help you to control your blood pressure and cholesterol. It can also reduce your risk of getting type 2 diabetes, or help control it if you already have it, and improve stress levels and your general feeling of well-being. It's natural for you to be anxious about how your heart will cope with physical activity if you have a heart condition. But physical activity is good for you and can benefit your overall heart health, provided you follow the advice given to you by your doctor or cardiac rehabilitation team. Active Heart, Healthy Heart has been carefully designed to suit your ability to exercise and your current level of fitness. It consists of 6 separate levels, ranging from a fully seated level through to a vigorous 20-minute cardiovascular workout. Make sure you start at the level your rehabilitation has advised and enjoy your journey to a healthier lifestyle. Good luck and enjoy.
This DVD has been designed to provide suitable physical activity if you're taking part in either a home-based cardiac rehabilitation program or a hospital-based cardiac rehab program. You should only use this DVD after you've had an assessment and discussion with an appropriate healthcare professional involved in your cardiac rehab. They'll have shown you how to monitor yourself during the exercise, how to do the exercises safely, and may have set your training pulse. They will also have given you the booklet that comes with this DVD. It's important that you don't exercise for at least 2 hours after eating food or drinking alcohol. You shouldn't exercise if you generally feel unwell, have a temperature, or have chest pain. And if you have been shown how to check your pulse, you shouldn't exercise if you find your pulse is much faster than normal or has become irregular. During the exercises, you should slow down if you are uncomfortably short of breath, if you're excessively tired or sweaty, or if you feel that your level of exertion is higher than advised by your cardiac rehab team. If you have been asked to record it and you find your heart rate is going above your advised maximum, you should slow down. If this doesn't bring your heart rate down, you should stop exercising. You should also stop if you feel dizzy or if you have a chest pain. Ask your rehab team for more advice. Each programme contains 3 sections: a warm-up, a conditioning phase and a cool-down. The warm-up prepares your body for exercise. The gradual build-up of activity improves the blood flow to the heart and the working muscles. This helps the oxygen to get where it's needed. The stretches in the warm-up improve your range of movement. The conditioning phase is the main part of the exercise session and will help to tone and strengthen your muscles and help to improve your heart's efficiency. You'll be able to progress through the different levels of exercise with the advice of your cardiac rehab team. The cooldown is about gradually slowing down your exercise so that your heart rate and blood pressure return to normal. They will both have risen during the exercise. You will repeat the stretches to try and prevent any stiffness which you might feel later and to improve your flexibility. It is essential to do all 3 sections and in the order that they're shown. Each time you use the DVD, make sure you follow the guidance in the Getting Ready section in the booklet. This goes through the essentials like the space you'll need to work in, clothing and footwear, and some basic equipment that you'll need to get ready. The DVD includes different types of exercise programme. There's a seated exercise programme for those who require a lower level programme. The warm-up for this is 50 minutes, the conditioning phase is 10 minutes, and the cool-down is 5 minutes. We also provide an assisted standing programme, using a chair for support. Finally, there is the standing exercise programme with 5 different levels to suit your current level of fitness. The warm-up for both these programmes is 15 minutes, the conditioning phase is 20 minutes, and the cool-down is 10 minutes. The assisted and lower level of the standing exercise programmes consist of exercises using mostly the legs, with short periods of easier activity in between, using mostly the arms. This is known as active recovery. The leg exercises are the conditioning or the aerobic activities that are so beneficial to the heart. The arm exercise in between provide a recovery period for the legs. As the levels progress, the duration of the aerobic exercises increases with less time spent on the active recovery exercises. In each of the fully standing levels, we explain clearly how movement can be made bigger or smaller to suit your needs. If you can, you should try and keep pace with either me or Caroline and alter the size of the exercise movements to keep you working at the right level of exercise for you. Caroline will show you the smaller movements, which are easier, and I will show you the bigger movements, which are harder. The movements don't get any faster as the levels progress. This is important to keep good control and quality of movement. You'll be doing a number of stretches in the warm-up and cool-down sections of your exercise programme. We'll demonstrate the stretches to highlight where you should be feeling the stretch when you're in the correct position. Remember, do hold on to a stable chair when you're doing the leg stretches if you need help with balance. There will be several points during your exercise session when you can record how hard or how easy the exercise feels using the exertion scale that your rehab team has explained to you. If you're not confident about how to do this, we've included instructions on how to use the scale in your booklet. Keep your feet moving during these checks and whilst you note your results. Last of all, remember, listen to your body and enjoy your programme.